Welcome to this online resource brought to you by PolicyWise for Children and Families. There are many unique challenges to the linkage and sharing of data in the nonprofit sector. Today, we will share some of our learnings about the governance issues around the use of data in the nonprofit organizations. For today, we will focus primarily on the social service sector, and of course, cognizant of the fact that there are many other services such as recreation, arts, and culture, but today we'll really focus in on the social services. And just to set the stage, in general, social services are delivered through a combination of government ministries and nonprofit or community organizations, typically through a contract with the government. But some may also be raising significant amounts of money on their own in terms of fundraising, as well as having philanthropic support from foundations. There are a wide array of organizations, even in this sector, from food banks that may depend heavily on such donations to children serving agencies that may have long-term significant grants from the government. And where this funding comes from will have a significant impact on the governance of that data. Now, in many cases, there isn't really a large amount of data exchanged between the government providing the funding and the community organization providing the service. This is often restricted to aggregate reporting in terms of, say, annual reports or reporting about how many people are served, services rendered, that type of high-level information. Whereas more individual level data, such as specific diagnoses, services for individuals, and outcomes may not be requested in some cases. In addition, when we're talking about the nonprofit sector, most of the organizations are very, very focused in on their specific mission of serving the client and the community. So in that way, they often may not have the tools, the capacity, or the time required to do as much with the data as they would otherwise have liked. So what this really represents is really an ocean of small, relatively isolated data sets that aren't necessarily used to its full extent. And there's a lot of value in this data set because it is data from community organizations, from community clients, and it can tell us a lot about how people are doing when they receive these services. Now, of course, within this broad sector of organizations that really cover a multitude of different services, there exist many different unique barriers that may be in place for the use of that data. So some may be attitudinal in terms of culture or of the organization internally or their funders. There may be technical barriers in terms of data not being collected digitally or even just in terms of paper and Excel, and not necessarily in a comprehensive database. There may be resource barriers, as we spoke about before, in terms of having the people or time that is required to work with this data. Today, we will focus mostly on governance barriers, and within that, mostly on the privacy and ethical issues around the use of this data. There are three key pieces of legislation to consider here. Of course, there are others, but let's focus on the FOIP, which is the Freedom of Information Protection Act, which is mostly applying to the public bodies in Alberta, say government or Alberta Health Services. There is the Health Information Act, which really then applies to the healthcare sector, so again, such as Alberta Health Services, hospitals, or physicians. And then there's PIPA, which is really governing the privacy of data within the commercial sector or around commercial activities. Broadly, in terms of privacy legislation, both across these three in Alberta as well as in Canada and nationally, the basic principles of having a defined purpose for a data collection that is related to a service, reasonableness of that data collection in that it's a regular person would find the level of data collected reasonable for that purpose, and of course the minimal extent in terms of really collecting just what you need for a particular purpose. So these are three key principles that really apply very broadly to privacy legislation in general. So one of the key challenges within privacy legislation for the nonprofit sector is that not all public bodies, they're not all public bodies, for example, right? And they may not all work under contract with a public body. And in some cases, some programs are with a government ministry, but some programs may be funded by a philanthropic partner. So there's really quite a difference in terms of how that data would be treated. And some only really would be working with either health data or healthcare professionals. So then HIA may or may not apply in those cases. And of course, for most of these organizations, there's very limited commercial activity, if any. And of course, that is then common to many of these service organizations. When we turn to ethics, one of the key aspects to recognize, of course, is that for many of these community organizations, we're looking at services to vulnerable populations. And so in terms of the considerations around what is best in terms of best interest for those participants is really key and in many cases quite complex. Consent is variable, so consent can be expressed or implied, and that is in terms of asking somebody more specifically versus a something that might be posted. They maybe opt in or opt out, and in some of these cases, again, dealing with a vulnerable population that may have issues around comprehension, language, some of these, and of course a very significant potential power dynamic between the agency and those receiving services, asking for consent or asking specific activities around the data use could be seen as coercive. Now, in terms of ethics, though, there are similar principles in terms of purpose or reasonableness and minimal extent for the activity that you're contemplating. Now, similar to the gap that is in privacy legislation that covers the nonprofits in Alberta, there's also a bit of a gap in terms of where nonprofits can turn for advice in terms of ethics. So the universities, for example, have ethics boards that govern the research projects that are within the university sector. There are research ethics boards mandated under the Health Information Act when it comes to health research. And there is an organization called ARECI that would give advice to the nonprofit sector in terms of some of the evaluation work that they might do. But there isn't really a place to go for official review and approval of a particular project or activity in terms of ethics. So what this really means is that for the nonprofit sector, they're really taking on all the risk and responsibility of use of this data without all the guidance that might be afforded by, say, a public entity or a commercial entity. And this is actually really important because for the nonprofit sector, many of these organizations, their existence is precarious in that they live grant to grant, and trust both with their funders as well as with the clients is paramount in terms of the ability for them to continue with their work and have that impact on the community. Of course, resources are limited, and those funding or opportunities are also extremely competitive. So these matters of governance are a challenge for many nonprofits to fully address and to document. Now, in a lot of work from policy-wise with the nonprofit sector, what we've been trying to espouse and convey is some best practices around the use, collection, use, and disclosure of that data. Now, part of that is, even though there isn't proper specific legislation that governs the privacy issues, but really to look at PIPA, for example, in Alberta as at least a guiding principle of that work. So towards that, then there really needs to be proper governance for collection, use, and disclosure of data, and this might mean policies. This might mean committees or groups or executives that have taken on the responsibility for looking at these issues. And at the end of the day, that documentation, that due diligence, is really one of the key aspects in terms of looking at what's best for both the clients and the organizations. And of course, using of minimal information to complete the task in terms of collection, use, and disclosure. And then where appropriate, have consent for use. And this really gets down to making sure clients understand what are the services that they're getting, and what are some of the implications for what might happen to the data that's collected during that service provision. It's really important to have processes and technical safeguards to keep data safe. So this might be, again, technical things like locking of computers or appropriate firewalls and whatnot. But it's really important to not just focus on technical things, but also policies, training of people, and to make sure that data is safe. One key piece that is within the legislation here in Alberta and other places is really the process for individuals to request their own information and also request changes to their information if there are errors. And of course, I mean, this is not necessarily always required for organizations that may not fall under privacy legislation, but it's just a really good idea to have in terms of having that process in place. What we really try to get across is to look at the organizational goals, what are some of the long-term benefits for clients, what would you like to understand about them, what could we do better in terms of service provision and evaluation and impact assessment, and really put that into the design of the work of the organization and all the data collected. So really looking at that secondary use by design and put that into a core mandate of the organization and the staff. What we really see is that there may be gaps, there may be uncertainty within this sector, but there really is an opportunity for innovation, because this is a space where a lot of benefits can come to clients and organizations if activities can be better driven by evidence and evaluations. And so we, as policy-wise, we work with the nonprofit sector to identify and work with leaders within this field to start pushing this envelope and start exploring what can be done and what should be done and what is best for the sector. Of course, Alberta government itself is also doing a lot of work in this area in terms of providing guidance and evidence in terms of an information sharing framework. I'll have the links towards the end of this talk, but we'll also have that below the video. And I think another big piece is really a piece around culture change and capacity building, to really make sure that the people at the organizations are embedded with skills and mindsets that really look at data as an advantage rather than an additional administrative burden. So these are just a few resources, and we'll make these links available below the video, as well as if you just send us a quick email. So the first is a white paper that we produced that talks about the nonprofit sector and its relationship with the existing privacy legislation and some of the ethical issues involved. And so I would definitely encourage you to have a look at that report. We have also devised a specific tool to conduct linkage at an anonymous level that really helps to give a cross-organizational perspective on client profiles. Again, the government of Alberta has released information about to help organizations look at how information is used and shared. And then this is lastly, this is the link to a recce, which is a really important resource to gain advice around the ethical considerations for projects within the nonprofit sector, including evaluation projects. So thank you again for joining us today for this quick discussion and sharing of our lessons with regards to the governance of data use in the nonprofit sector. I invite you all to get in touch with us through the email on the screen. Give us a call. We're happy to connect and just brainstorm about what we can do better. Thanks.